Hi, Maureen. My problem is with depressed scars that cause me serious self-confidence issues to the point that I never wear my hair up and I let it drape over my face as much as possible. These scars are a result not of acne, but of acids that were not applied properly, specifically TCA. I'm not sure what that is at my own hand. 10 years ago, I have seen very little improvement since beginning laser treatments 6 in the past year. I'm wondering what my options are for the greatest shot at improvement.
So let's start with what TCA is, because I think that's probably important. So TCA is something called trichloroacetic acid, and TCA is used as a medium depth chemical peel. And so when we have patients coming in for certain skin concerns, sometimes we will use TCA very selectively, very carefully to try and remedy some textural issues with the skin. But it is a pretty aggressive acid and you can actually cause real damage with it. And so the idea of someone doing it themselves makes me a little bit uncomfortable just off the bat.
Mhm.
These are professional grade acids and they can be very aggressive. When you apply TCA, what it does is essentially peels away the entire surface layer and part of the second layer of skin. And so
Whoa.
when you're getting into that second layer of skin, that's where we talk about creating scars. So we've all done it. You fall and scrape your knee and you end up with a big white scar on your knee and the edges kind of heal in really nicely and the center looks really bad. And you're like, well,
Mhm.
if the whole knee scraped, why does the center look so bad? And that's based on the depth of the injury. And so when you injure the skin deeper, you create more scar tissue. And so, what I would say in terms of trying to fix this really depends on the kind of laser that you're having. So, you can have 6 clear and brilliant lasers, and nothing would happen for textural scarring. You could have 6 redness lasers or pigment lasers. You could have very, very low dose laser called Fraxel, which is a different kind of resurfacing laser. But the truth is, when you're looking at deep scars, you need to do a combination of different modalities. So oftentimes, when patients come in with really deep textural scars, sometimes from acne, sometimes from other issues, what we really want to address is we want to address the depth of the scar. You want to start to create little micro injuries from below and start to sort of controlled wound the skin to help new skin cells form and start to heal in some of that scar tissue. But when you wound from below, you can actually help release some of those scars and then they kind of bounce back up and you get a much better textural improvement. And so I think it's just going to depend on the modalities of treatment that they're choosing. And sometimes using 2 different modalities together can give much better results than a single one by itself.
So there is hope for this patient who is so self-conscious that she's
Mm-hmm.
wearing her hair down all the time and worrying about the lighting in any given room. Dr. Weiser, how does a patient like this find the right dermatologist who is going to know how to attack it the way you just described?
So I think the key is making sure that you're seeing somebody who is really a laser expert and doesn't have one device in their office that they use for everything. In my practice, I have 20 different devices, and so we can really cover a very broad range of different skin concerns. And sometimes patients say, well, oh, I have one laser, I can treat everything. And the key is that sometimes that is just either an underpowered device or a device that has lots of different hand pieces that don't do quite enough. And so look for someone who is published, look for someone who is, on faculty at an academic center. Often that kind of affiliation gives some credo to what they're doing, but also look for people who have a really broad range of devices and offerings in their practice, because one single device isn't going to get you the full result.
It's so true. And I mean, I go to you for lasers and you always talk to me about, no, you don't need this. That would be way too intense. Like we're going to do this. You're very, 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 shrewd and strategic about how you treat any given patient. Here's another one from Troublemaker Jenny. I have a history of melanoma and am considered high risk. I have a lot of sun damage on my face. I have been told because of this risk, I cannot get IPL, Fraxel, or any type of lasers because I can laser off too much of the early warning signs of precancerous lesions. On the flip side, I've also read the exact opposite and that someone like me should get lasers as a preventative. What is the truth?
So the key here is that there are certain kinds of lasers that are amazing for prevention. And there have been some studies in the past couple of years showing specifically that the 1550 nanometer Fraxel, which is not a Fraxel that treats the surface for brown spots, but the track Fraxel that kind of gets a little bit deeper can actually be really wonderful at helping to prevent or decrease the frequency of skin cancer in patients who have a lot of sun damage and are prone to skin cancer. So not melanoma specifically, but the two more common skin cancers called basal cell and squamous cell. And so we actually do encourage these patients to have non-ablative resurfacing procedures and to not go with things like IPL. We don't want to just peel away pigment on the surface. What we really want to do here is we want to actually get underneath the surface and create what we call microthermal zones, where we're creating these little tiny controlled damage spots under the skin. And what that's allowing the skin to do is create new fresh skin cells to replace some of the damaged cells and slowly turn over and reduce the risk for future skin cancers. So I think this person could be a great candidate for something like a Fraxel 1550 without doing something like an IPL that's just taking away that surface red and brown.
Phenomenal. Okay, please keep my name anonymous. This is a straight man with a manly job who has a question for you. I started to lose my hair at the age of 16. I am now 27. It was the most painful and humbling experience of my life thus far. I even had a doctor tell me that I should get a wig at 16. I took Accutane at age 15, 16 for acne, and it depressed me more than I thought I could handle. Could this be the cause of the hair loss, and what, if anything, can I do?
So Accutane and hair loss are not directly linked. And so could it be an exacerbating factor? Possibly, but most likely this is some form of a genetic hair loss. We have patients who go on Accutane all the time who have temporary shedding, but they always regrow their hair. We really don't see significant long-term issues with hair loss and Accutane specifically. And so most of the time when patients start to lose their hair that young, what we usually find is that there is some underlying medical issue. Sometimes these are what we call scarring hair loss conditions, where we actually see the hair follicles replaced with little fibrous tracts or scars, and then the hairs cannot regrow. And so what this person should do is this person should find a hair expert, and most major cities do have a great hair expert. New York has many, and have an actual small biopsy of the scalp. So we take a little cookie cutter sample. It sounds really graphic and gory, but it's actually not painful. We numb up the scalp. We take about 4 millimeters of tissue and we send it to the lab. And under the lab, they can look at under the microscope and they can determine exactly what's happening in those hair follicles. So there are two main categories of hair loss: what we call non-scarring hair loss, which is generally treatable and often reversible. And then there is scarring hair loss, which is usually not reversible. And so the key with scarring hair loss is trying to diagnose it really early and to try and get ahead of it to prevent it from getting worse. But non-scarring hair loss has a lot of treatment options out there. And the idea is identifying it, figuring out what it is, and then proceeding according to the type of hair loss appropriately. And so I think that finding an expert would be his first step. And we can go, and certainly you can go from there, but there is definitely a pathway forward.
I love this. Dr. Weiser, my 19-year-old daughter has chronic, horrible acne, and it is causing her extreme anxiety and misery. She has seen docs who recommend, I'm going to struggle with this,
Spironolactone.
Thank you.
Spironolactone. Got you.
Thanks, Dr. Weiser. And birth control with little help so far. She is nervous about taking Accutane. Does your derm expert have any other ideas?
So acne, chronic, severe acne is very challenging. The only other idea besides Accutane, so Accutane gets a really bad rap and people are very frightened of it. There are two ways of taking it. I'll get into that first, and then I'll tell her about some alternatives. But the two ways you can take Accutane are the classic way, which is taking full dose Accutane, meaning 1 milligram per kilogram of body weight taken daily. So let's say you have a patient who's 130 pounds. We're putting them on 60 milligrams of Accutane, and they're taking 30 in the morning and 30 at night, usually for about 6 months. And most of the time that reaches a nice total dose, and they most of the time, we say about 70 to 75% of the time, are cured from their acne or at least dramatically improved. That is the classic way to take Accutane. And the problem is that a lot of patients complain about dryness. People complain about chapped lips, sun sensitivity, all kinds of just daily issues You can't drink, it can affect the liver. And so what we find with Accutane is that a lot of us have adopted a more modern approach where we actually dose it at a very low dose. And we have patients, instead of taking 60 milligrams a day, we often actually now have patients taking 20 milligrams a day. And so you take it for a lot longer, but you're really limiting the side effect profile, and it's so much easier for people to handle. And so, for example, that would be one alternative that would be worth a discussion, just to say, is there a way to take less Accutane for a longer period of time to minimize some of the side effects? The alternative to Accutane is really some of the newer lasers, and there's 2 lasers on the market right now for acne, one which is definitely the easier to tolerate and one which is a slightly more aggressive laser. And the first one that came to market was a laser called AviClear, AVI Clear. And AviClear is essentially a laser that targets the sebaceous gland. And what we know about acne is that acne is an inflammatory disease of the sebaceous gland, or the oil gland in the skin. And so much like Accutane targets those glands, this laser actually targets the glands, and treatments are done spaced a month apart. 3 sessions is recommended, and then we wait 6 months. And for most patients, we are seeing significant clearing in their acne from the laser. And so that is certainly something to look into. The slightly more intensive version is a laser called Accure. It's not a device I offer in my practice just because it requires injected numbing into the face. And so it can become a lot of swelling, a lot of bruising, a little bit more downtime. But AviClear is quite easy to do. A treatment only takes about a half hour, and there's really almost no downtime at all.
And by no downtime, this is the lasers that I typically get with you. You mean you walk right out of the office, you look like maybe you took a little bit too much sun, but nobody would ever know you had like a major intervention just done in an office. You're good.
Yeah, exactly.
Hi, Dr. Weiser. I am 48 years old and have under eye hollows, sunken tear troughs, which make me look worn out and tired. Now she's asking how she can improve this area without fillers, but I just want you to come at this, Dr. Weiser, with your best answers, because I think there's a misconception out there that there's nothing you can inject under the eyes to solve this problem.
So lots of different things that you can do about under eye hollows, but there is not a cream on the market that is going to fully erase an under eye hollow.
Thank you for saying that.
It
Thank you
doesn't
for
exist.
saying that.
I think that there is such a big misconception that, oh, you're going to use an eye cream with caffeine, or you're going to use an eye cream with, hyaluronic acid, and it's going to somehow replace the lost fat pad under the eye. It doesn't work. It doesn't happen. Patients are super frustrated by the whole process. I've tried 40 eye creams. Nothing has helped. Of course not. The real, answer here is surgical versus non-surgical, and non-surgical is what I do. And so the idea of what can you inject under the eye? There's a couple of options now, and certainly the most routine that people still have done, if you're a good candidate, not everyone is a good candidate, but if you're a good candidate, small quantities of a hyaluronic acid filler injected under the eye can be fantastic. It has to be for the right person. There's certainly going to be patients who are not good candidates for filler. Some people have a lot of puffiness or swelling underneath the eyes. We don't like to put filler in those people. But if you have a true hollow and a very demarcated sort of bone line that we can follow, and you don't have a lot of swelling or puffiness, filler can be magical. It literally just makes you look rested. I always joke that I tell patients who are good candidates, it's going to make you look like you've been sleeping for 2 weeks. You wake up from a beautiful 2-week nap and you look incredibly refreshed.
I do this with you. And as you predicted or said, because you're the expert, when I first began doing it, you said, the more you do it, the less you're going to need it. So you may start off getting 2 or 3 treatments a year, and then you're going to space them out. It'll probably be like 8 to 9 months because the body learns how to sort of retain a lot of that filler.
So the body does hold on to filler. And we've learned this, recently over the last, 5 to 10 years, that it doesn't go away 100%. And in an area like the under eye, in a good candidate, that's wonderful. And so what we find is that, I would say even in your case, we just space it out more and more, but you look consistently rested. Other things that are nice to think about when people go, I really, really don't want filler. I really feel, morally opposed to it, or whatever it is. Everyone has their, their own shtick, as we say. But people have their own things that they're bothered by. Things that you can think about, a series of PRP or platelet-rich plasma for some patients can improve the skin quality and can give a little bit of sort of a plumping underneath the eye, not quite as precise as using filler. And we also now have something called PRF, or platelet-rich fibrin, or platelet-rich fibrin matrix, which is sort of a gel that is composed of products from your body directly. So it's platelets and growth factors and fibrin that we draw out of your bloodstream and spin down in a centrifuge and then re-inject under the eyes. So sort of what people consider more natural filler.
I feel like that procedure should be named after Keith Richards. We're going to have our producer Marlaina come in and ask you her question in one moment, but I wanted to ask you about the relatively new phenomenon of younger and younger women getting facelifts and what you think of this, what the potential pros are, the cons are, how long a good facelift will last. And let's say if you begin at 30 or 35, how many facelifts you're looking at down the line if you want to maintain.
So what I think is really important to understand about a facelift is that there should be some kind of criteria on which you have enough laxity, there has to be some standard, because in theory, you could do a facelift on every single person on the face of the earth. I mean, the same way that, patients say, well, should I start Botox before I've ever had a wrinkle? No, when you start to get little fine lines, we start to cross a threshold and say it's an appropriate treatment. The same thing applies to a facelift. There are non-invasive treatments that can yield excellent collagen stimulation, excellent elastin restoration, and give us essentially a nice long track so that we're supporting the skin and we're allowing it to, sort of slow down or sort of abort some of that aging process. And so going straight to surgery, let's say you've lost 100 pounds and you have sudden onset, really severe laxity, I could understand why you might need a facelift, but that is very, very rare circumstance. And so this idea that people are getting facelifts in their 30s, to me, is really premature. And I think that there's a lot of controversy out there in the aesthetic community where a lot of surgeons are saying that, lasers and energy-based devices shouldn't exist at all. They serve a really beautiful purpose. And I think that, a facelift should be reserved for a certain kind of person who really needs surgical intervention. Generally, what we say, there's two kinds of facelifts that are predominantly popular in the world right now. One is called the SMAS facelift, which is sort of an older technology. It gives a slightly more subtle lift than sort of newer technologies. And so patients who want a more subtle lift, but do want to improve the line of the jawline, or they want to lift sort of the lower face, can get a subtle lift with a SMAS lift. For patients who have severe laxity or who want a more drastic lift, people are now referring to what's called a deep plane facelift. And so we usually say a SMAS lift in most people lasts about 10 years. A deep plane facelift can last 15 plus. But really, the truth happens. We continue to age even after we get a facelift. And so having a facelift does not stop the aging process. Collagen breaks down. We live in a world with UV and pollution and free radicals and oxidation, and aging continues to happen. So you are not going to look 30 forever because you had a facelift at 30. You are going to continue to age from that same baseline.
And just before we move on to Marlaina, can we talk a little bit about, we're seeing this in faces that we know, where we're seeing an effect where mouths seem to be stretched out, where the lips, I asked you about this because it seemed like it was filler, but you said, no. Like, I think it's surgical where you're seeing lips sort of, they end at like the end of the eye. Like, what is that procedure? And, would you recommend it at any point?
So there are a couple of surgeons out there doing what they call a scarless facelift, and they're essentially not removing skin. Part of a facelift is actually literally taking the skin, cutting in front of the ear, and removing some of the skin from the face. And that's why there is a surgical scar, because they need to go inside the face. So these scarless facelifts make a very, very tiny incision, and they essentially go in and lift the deeper tissue and sort of pull it back without removing the skin. And sometimes what ends up happening is you end up kind of catching the corner of the mouth and pulling it laterally. And what it does is it splays the mouth really wide on the face, and it can be very distorting looking. And so usually that very wide mouth is often the sign of either a not great facelift or sometimes a scarless facelift, where they don't really have full access and full visibility under the skin surface like they do in a standard facelift.
Got it. Okay, we're going to bring Marlaina in, who has a couple of questions for Dr. Weiser. Producer Marlaina, ask away.
Okay, I have a few questions. One, does microdermabrasion work for scarring or anti-aging?
So there's two different procedures. Microdermabrasion is essentially just a procedure that pulls away dead skin cells. And so microdermabrasion primarily works for decongestion. So patients who have a lot of blackheads and skin congestion, sometimes people complain of little black dots on their nose called sebaceous filaments. We like microdermabrasion for that purpose primarily. When you think about scarring and anti-aging, you really need to get into the deeper layers of skin. And there's a very sort of old school technique called dermabrasion, where you actually dermabrate or peel away sort of little bits of skin. And it makes the skin very red and very raw. And it's not done very often anymore. Most of the time when people are doing dermabrasion now, it's because they don't have resurfacing lasers, but most of that dermabrasion, the more aggressive form, has been replaced by laser resurfacing. And so microdermabrasion is a really nice sort of skin pick-me-up, but you're not going to see drastic anti-aging benefits from just microdermabrasion alone.
Okay. My biggest issue is my eyebrows, and I think that they go down. Okay. And I think I've been told by two dermatologists that I need an eye lift and that I can't accomplish what I want with Botox.
Okay.
On the sides.
Oh.
Just a little bit of a lift.
So
What's
I think that
truth?
you probably could get a little bit of a lift. Everyone has different anatomy, and I haven't injected you, so I'm not totally sure. But there is a muscle, essentially part of the muscle that encircles the entire eye, called the orbicularis oris. And the orbicularis oculi. I apologize. Orbicularis oris is around.
I wouldn't know the difference anyway.
It's okay, but somebody will, and I'll get called out for it. So I'll correct myself. So the orbicularis oculi is a muscle, and it runs in an entire circle all the way around the eye. And it actually pulls down on the eyebrow a little bit. And so the idea with Botox is that if we can put tiny little microdroplets of Botox into the lateral part of the eyebrow, just underneath the brow, essentially, what happens is we weaken the muscles that pull down, and it allows us to elevate the tail of the eyebrow a little bit. And this works to differing degrees on differing patients. Some patients get an amazing lift, some patients get a subtle lift, but it does generally help a couple of millimeters on everybody. So certainly something worth trying. If it doesn't work enough, you can always step up to something more intense, but I definitely think it's an easy first step.
And may I just say before your next question, Marlaina, Dr. Weiser, when you say a couple of millimeters, when it comes to the face and adjustments on the face, a millimeter is a huge impact, correct?
Yes, absolutely. So, when you think about millimeters in life, you're like a millimeter of fingernail, you're like, whatever. A millimeter lift on your eyebrow can actually make an appreciable difference.
Oh, I believe it. I just want it to happen at this point.
Yeah. Another thing to think about, just going back to your eyebrows, just to throw out one other idea, is that there is a treatment on the market called Soft Wave. It's been really hyped up by, the Kardashians of late, because they've figured this out and realized that it's a really effective ultrasound-based collagen stimulating device. And it actually has an FDA approved indication for brow lifting. And so we can actually use the ultrasound technology over the brow bone and up the forehead. And we are accomplishing anywhere between 2 and 4 millimeters of eyebrow lift using completely non-invasive ultrasound technology as well.
Wow.
So
and that
just
lasts?
another food for thought.
And that
we typically
lasts?
repeat it once a year.
Once a year. Okay. And the other question I have is the lines on my upper lip. I've had a lip flip. I've had hyaluronic acid in my lips to kind of plump up this, but it's not as effective as I would like it to be. So what would you recommend?
So the treatment of those upper lip lines, people call them all kinds of things. I've heard it referred to as a shower curtain. I've heard it referred to as a barcode. I've heard it, people call them smoker's lines. The idea there is that as we age, we start to lose the superficial fat that separates the skin from the underlying muscle. And if you think about it, the muscles that work the most on your face are the ones around the mouth and the ones around the eyes. And so if you constantly contract that muscle, what ultimately happens is the skin starts to bind down to the muscle. And so every time you contract the muscle, you're contracting the skin. And so the things that we like to do here are twofold. There's laser resurfacing. Again, I use a device that's an ablative resurfacing, meaning it actually takes away some of the surface of the skin. And sometimes we even use things called microcores, where we actually remove teeny tiny little 0.17 millimeter samples of skin and resurface that area. Or there's actually a certain type of filler that we can use that's a very, very small particle hyaluronic acid that you can actually put directly into the line. So not necessarily into the lips to enhance the lip proper, but directly into the skin above the lip and sort of create this almost sort of airbrush-like effect from these tiny micro droplets of filler.
Okay. I will try that. And then just tell me what I need to do for my neck, and then I will let you.
And that is, and then,
back.
yes, and we have gotten questions. I have one here also. My question is, what can you do for your neck without surgery? I am 66 and my neck is much worse than my face.
So it really depends on how intense the laxity is. We typically say from mild to moderate laxity. So Mariana, you're a great Marlaina, sorry, you're a great candidate because you don't have a lot of laxity. When we start to see that the neck hangs or that there's a lot of skin laxity, we find that really surgery is the only option. But before that, so like for you as an example, there's a couple of different treatments that I like to use on the neck. I'm going to use it again because I do like it. Soft Wave is wonderful for lifting in the neck. We typically do 2 treatments. We separate them about 3 to 6 months apart. And what we find is that we actually relieve some of that creepiness and some of that skin laxity that develops in the neck. And it works really beautifully. I treat my own neck with it. I love it. I think it makes a huge difference. And so that's helpful. I also love to put Botox in something called the platysma bands. So as we get older, there's a muscle that runs from our jawbone to our collarbone. And when we're really young, it's like a sheet of tissue paper and it sits really beautifully. And you look at a young neck and you're like, it's gorgeous. It's perfect as it is. And as we get older, that muscle starts to form little bands and little gaps. And those bands start to form these sort of areas that pull down on the skin and sometimes pull down on the jawline. And so we frequently will put little drops of Botox into the neck, relax those muscles, and the whole thing kind of tucks underneath really beautifully. So those are 2 things I do all the time. And I think that it actually can make a really nice difference and also really save off surgical procedures till, a later stage, if ever.
It's been over 16 years since the federal minimum wage was raised to $7.25. Company productivity in that time has doubled. Has your wallet? 1 in 5 Americans can't even qualify for a basic credit card. The system is broken. We all know it. And everyone deserves access to decent housing, transportation, and financial stability. That's where Kickoff comes in. Kickoff helps you build credit fast with affordable plans starting at just $5 per month. No hidden fees, no interest, just on-time payments that get reported to credit bureaus and help you grow your score. Users with credit scores under 600 points saw an average increase of 84 points in their first year. With premium plans, you can even build credit with the rent you're already paying. Only positive payments get reported. It is so easy to get started. You sign up in minutes from your phone. No credit check, no hassle. Over 1 million users and hundreds of thousands of 5-star reviews make Kickoff the #1 credit builder on the App Store. Start building credit today and get your first month for just $1 at getkickoff.com/Maureen. That's GetKickoff.com/Maureen. You must sign up via getkickoff.com/Maureen to activate this offer. The offer applies to new Kickoff customers first month only. It's subject to approval, offer subject to change, average first year credit score, impact of positive 84 points, Vantage score 3.0 between January 2023 and January 2024 for Kickoff credit account users who started with a score below 600, who paid on time, and who had no delinquencies or collections added to their credit.